What if we keep all the benefits of the Affordable Care Act, Obamacare, but change the funding, administration, and operational mechanisms? What if we remove our federal and state governments from any administrative and operational duties in providing health care and limit them only to the funding mechanism? What if, in doing so, we eliminate the need for Medicare and Medicaid and provide health care insurance for all U.S. citizens and legal residents? Check it out. There's Obamacare, and then there's this proposal. Under Obamacare, more than 80% of U.S. citizens and legal residents are covered. That means almost 20% still have no health insurance. Under this proposal, 100% of all U.S. citizens and legal residents would be covered. First of all, it's important to note that all those currently using Medicare or those about to use Medicare within the next few years will be able to continue using Medicare under the current system unless they elect to switch to the plan offered in this proposal. Second, everyone, including those in Congress and those working for our federal and state governments, will be covered under this plan. 100% of all U.S. citizens and residents will be insured. So how do we accomplish this? To understand this proposal, it is first necessary to see certain aspects of how large group healthcare plans operate. Large group healthcare plans are generally based upon where we work. And the larger the plan, the better the plan works for both insurers and those it insures. It's better for group healthcare insurers because it allows them to spread the costs of providing payments for the sick over the majority of premiums it collects from the healthy members of its plan. It's better for those it insures because if the insurance group wants to raise its premiums, it must do so by the same amount for all those it insures. So why are most group healthcare plans still based upon where we work? Why can't we just join whatever group plan we choose and not need to get a job at the place that offers the healthcare insurance plan that we like? Why, when we switch jobs, why do we need to switch to the plan offered by our new employer? Why? In the past, in the pre-computer internet age, insurance companies preferred to deal with a few people in an employer's human resources department and not with hundreds and/or thousands of people individually. So why, in this computer internet age, when claims can be handled much more efficiently, why are large group plans still based upon where we work? We can only guess that this is because of habit and a lack of vision. What if a person selected and joined a large medical group insurance plan and that plan stayed with them unless they decided to make a change? What if it were possible to keep that same plan even if you temporarily lose a job? What if the plan stays with you when you retire? So how is it possible to get all those able to pay health insurance premiums to stay with their insurer of their choice and still provide insurance for those unable to pay insurance premiums? We assess all income, not just wages, up to a specified income level. By all income, we mean wages, self-employment income, interest, dividends, and capital gains, rents, royalties, all other sources of income. Then, for wages earned, the largest funding source of this plan, 3.95% will be assessed from an employee's pay, and the employer will match that amount with an additional 3.95% of the employee's pay up to $500,000. If this may appear to be just an additional burden that the employer must bear, keep in mind that after a specified transitional period, there will be no need for Medicare. Therefore, the 1.45% of an employee's pay that must be borne by both the employee and employer will be unnecessary. The removal of this tax will reduce the medical insurance assessment from 3.95% to 2.5%, effectively for both the employee and the employer. All assessment payments will be pre-tax. Here are some payroll examples. For an employee earning $30,000 annually, the healthcare assessment would amount to a monthly payment withheld from the employee's pay of $98.75 for both the employee and their employer. For an employee earning $50,000 annually, the healthcare assessment would amount to a monthly payment withheld from the employee's pay of $164.58 for both the employee and their employer. Dependents. If an employee wished to cover any dependents, they would be assessed an additional 1% of their wages up to $200,000, but the employer would not be required to match that amount. In all cases, the employer pays no more than 3.95% of the employee's pay, and after the Medicare tax is removed, 2.5%. An employee earning $30,000 would pay an additional $25 per month for each dependent they wish to cover. An employee earning $50,000 would pay an additional $41.67 per month for each independent they wish to cover. Healthcare assessments for those not receiving wages. The wealthy, those not needing to work or just not earning wages, the self-employed, early retirees, and regular retirees deciding not to continue with Medicare would be assessed at 7.9%, 3.95% plus 3.95% of their earnings up to $150,000. And then at 3.25% of their earnings from $150,001 to $500,000. For those who are retired, an estimate of what the average retiree on Medicare might pay for health care. Medicare Part A, $0. Medicare Part B, $137, subject to change. Medicare Part D, $55, estimated. Medicare Supplement, $170, estimated. Total Medicare monthly costs, $362. Under this proposed plan, a retiree currently on Medicare would not pay more than the estimate above unless they were receiving more than $1,500 per month from Social Security and had income from other sources greater than $3,082 monthly, a total annual income of $54,987. Under the proposed plan, a retiree whose sole income is $1,000 monthly from Social Security would pay $79 monthly. Under the proposed plan, a retiree whose sole income is $2,000 monthly from Social Security would pay $158 monthly. Former dependents over 25 years old still unemployed and laid-off workers having no other sources of income will be assessed $99.28 per month. However, if they can't afford this payment, they may still receive healthcare insurance through the general pool. Part-time employees. Since the healthcare assessment is based upon the very first dollar earned, there will be less incentive for employers to keep employees working only part-time. However, if an employee is still unable to get full-time work, they will be able to keep their group insurer and not be assigned to the general pool by working more than one part-time job until their wages total $15,080 annually, and therefore will be assessed through their wages $49.64 per month. The general pool. For those with little or no sources of income, the general pool will be available. Group insurers will be required to take on a certain number of general pool participants gratis. The disadvantage of being in the general pool, or GP, is that GP participant will not be able to pick their health group insurance plan and also may not be able to use the doctor of their choice. The health insurance group will be permitted to require that the participant only use doctors within a certain group or within a certain geographic area, except in emergencies. These limitations would be similar to those imposed by most health maintenance organizations, or HMOs. If the insurance company has more than one health insurance group established, they might be allowed to place general pool participants in a separate group, since the operations of the pool would be different from those of the group insurer with non-general pool participants. The general pool should eliminate the need for Medicaid, CHIP, and certain Medicare payments that federal and state governments must make to these organizations. When will Medicare be phased out? After those currently in Medicare decide to switch to this proposed plan, and after the deaths of all those not deciding to accept the insurance offered in this proposal, but to continue under the Medicare system. For the most part, this should occur within the next 15 to 20 years. Deductibles and maximum out-of-pocket costs under the plan. There will be no deductible or copays for single individuals earning $15,080 or less and married couples earning $30,160 or less. Above those amounts, the deductible amount would be based upon the person's income. In other words, on their ability to pay the deductible. All insured would be able to contribute to a pre-tax account similar to a health savings account or HSA up to the amount of the maximum out-of-pocket costs of their plan. Advantages for wage-earning individuals. All workers will be insured. Part-time workers may become full-time workers, since healthcare insurance will be assessed from the very first dollar earned, so there will be less incentive for employers to limit the working hours of employees. However, if the worker is still unable to obtain full-time employment, they would be able to obtain full-time coverage without going into the general pool by working more than one part-time job and or earning wages at least equal to $15,080 annually. Employees need not worry about losing their health insurance by switching, losing, or quitting their jobs. Their insurer stays with them unless they elect to switch insurers. Advantages for employers. Employers not currently providing healthcare insurance benefits. Those keeping most workers part-time to avoid paying healthcare benefits will now be able to keep fewer, more reliable employees full-time and keep those employees longer since they now provide healthcare insurance. Will this proposed rule make it too expensive for small employers to operate? Since the proposed plan removes the need for Medicare after a transitional period, the 1.45% Medicare tax that employers pay will be eliminated, and the net effective cost to employers will be 2.5%. For example, employees earning $15,080 annually, the federal minimum wage, will cost an employer $49.64 per month, and when we factor in the eventual elimination of the 1.45% Medicare tax, the net effective cost to the employer will be $31.42 per month. For employers not currently providing healthcare benefits, for example, employees earning $30,160 in annual wages, or double the minimum wage, will cost an employer $99.28 per month, and when the eventual elimination of the 1.45% Medicare tax is factored in, the employer's net effective cost will be $62.84 per month. Are these additional monthly expenses to retain fewer, more reliable employees too costly for small employers? It is important to ask those employers that do not currently provide healthcare benefits to their employees who pays for their employees' medical care. The taxpayer does. Is it fair for the taxpayer to bear these costs? Employers already providing healthcare insurance to their employees should experience a significant decrease in their healthcare expenses. Advantages for the self-employed. One of the primary benefits of this proposed plan is that individuals will possess the ability to transition from a wage-paying environment as an employee to starting their own business without needing to worry about being able to obtain and afford healthcare insurance. And once again, as mentioned previously, since the proposed plan will eventually eliminate Medicare after a transitional period, the 2.9% a self-employed person pays for Medicare in their self-employment tax should be eliminated, resulting in a lower effective net assessment of 5% on their earnings for healthcare. For example, those making self-employment income of $80,000 will pay a healthcare assessment of $526.67 per month. If we factor in the eventual removal of the 2.9% Medicare tax included in self-employment tax, the resulting effective monthly assessment will be $333.34 per month. Advantages for laid-off employees and former dependents over 25 years old. Under this proposed health care plan, those laid off and former dependents over 25 years old and still unemployed will be able to keep their existing insurance group by paying $99.28 per month. If they have dependents, they would be able to keep them in the same plan by paying an additional $12.57 per month for each dependent. If those unemployed, temporarily or otherwise, find that they are still unable to make the monthly payment, they will still be able to obtain coverage in the general pool. Advantages for those about to and those currently using Medicare. We have already shown examples of how much healthcare insurance will cost under this plan versus the cost of Medicare coverage. However, the greatest advantage to those currently collecting Medicare and those about to do so is that if this proposal is adopted, a healthcare plan will still be in existence 20 years from now. And in most instances, the plan will cost them less than they are currently paying for Medicare Parts B and D and a supplemental Medicare insurance. However, if they choose, they may stay with Medicare as it currently exists for as long as they wish. So how do we reorganize group healthcare plans with no ties to where we work? Legislation must promote and provide economic incentives for the establishment of large group healthcare plans. These plans must provide specified minimum coverage, pay minimum benefits, and follow minimum medical fee paying rules and other standardized guidelines, like requests for documentation from the healthcare provider. To provide incentives for insurers to offer health insurance group plans, caps on federal and state taxes might be offered, such as 10% ceiling on federal income taxes, and no state income taxes. Low-cost loans might also be provided and/or guaranteed to newly formed healthcare groups. A final note, will everyone be pleased with the effects of this proposal? Definitely not. But at this point in time, what are our alternatives? The proposal will hurt the least and remove our governments, both federal and state, from the healthcare funding crisis, which looms in our not-so-distant future, and provide health care for all. Will there be abuses under a non-governmental healthcare insurance system? Definitely. But compared to what we have now, compared to what will result if nothing is done, or compared to the abuses and gross inefficiencies that would result if a national healthcare plan were adopted and operated by federal and state governments, potential abuses under this proposed plan would pale in comparison. However, during the learning curve period that will occur if this proposed system is adopted, legislation might correct abuses and tweak the operational performance of the plan.